Let us discuss about toxic shock syndrome. Toxic shock syndrome is a multi-system disorder. It is a multi-system. It is a multi-system disorder. It is caused due to Staphylococcus aureus infection. Staph aureus mainly. It is caused mainly due to Staph aureus. The infection of mucosa, skin, all these things. Infection of the skin and mucosa by Staphylococcus aureus. It leads to this toxic shock syndrome. It is a multi-system disorder, and the risk factor is main important risk factor is uses of tampons in females. It is very important, very important risk factors. There are certain other risk factors, even skin wounds, surgical wounds, skin and mucosa infections, all these things come under risk factors, but the most important risk factor is use of tampons in females. Okay, this we must remember. So mainly the Staph aureus strain is bacteriophage type 1, bacteriophage group 1. This is the strain. Okay, this is the strain of Staphylococcus aureus which causes this toxic shock syndrome. Let us see this Staph aureus. It produces enterotoxin, toxic shock syndrome toxin. Okay, we can say TS, toxic shock syndrome toxin. Okay, it produces this toxin. This toxin usually of enterotoxin F, B and C. Okay, F, B and C. These are the toxins that come under this toxic shock syndrome toxin. Okay, this toxin is a super antigen. Okay, super antigen, as all of us know, super antigen in the sense it activates lymphocytes non-specifically. Okay, this lymphocytes activation it leads to organ damage. Okay, multi-system organ damage. Okay, and this is about how it affects. And clinical manifestation. The patient present with fever, hypotension, erythematous rash. Okay, next diarrhea, vomiting, myalgia. Okay, these are the main symptoms with which the patient presents. And next coming to diagnosis. The diagnosis mainly will identify the toxins. Will identify TSS1, toxic shock syndrome toxin. Okay, we'll identify this by latex agglutination test. Latex agglutination test. And second one is enzyme immunoassay. And third one is, and these are two important tests through which we can identify this toxin. And third one is we'll also identify the genes TSS, toxic shock syndrome. We'll identify the genes, gene 1 and gene 2 of this toxic shock syndrome through PCR. Okay, genes 1 and 2 through PCR. And this is about diagnosis. And the coming to treatment is clindamycin. This clindamycin, it inhibits the synthesis. Okay, this is about toxic shock syndrome. Thank you for watching.